Hope Channel, changing lives.
Good evening, ladies and gentlemen. You are welcome to the consulting room. Today, I'm in the studio alone, but trust me, I'm not alone. I'm in the consulting room with one of the best urologists you can find around in our country. So today we are going to have a very nice and interesting conversation about the prostate. I think it's one of the organs that men really cherish in their bodies. Aside their penises, sorry if I've grossed you out, but this is the consulting room, so we talk about the human body as it is. So aside the male penis, the prostate too is quite a very important organ to men, because if they hear anything about prostate, being it's the cancer or an inflammation or anything that concerns the prostate, they are very eager to learn more about it. And today we have Dr. Isaac Owusu-Entwi, who is a urologist. He's a urologist at the Conversational Teaching Hospital and Tafo Government Hospital, both in Kumasi, and he is joining us today. We are going to talk about men's health. Basically, it's a conversation about benign prostatic hyperplasia. He will explain those three big words to us very soon, and I'm sure we'll all learn a lot from it. Today's show is not just for the men. If you are a lady, if you're a woman, if you're a girl and you're watching me, do well to stay, because you can learn and teach your brother, your boyfriend, your husband, your fiancé. You can teach them about all of this so that they will be very beneficial to you. As usual, we have cocoa milk sponsoring us. I urge all of us to go for this very healthy milk option so that you can be healthy, yes, in the long run. Also, during the course of the program, if you have any questions, if you have any contributions, if you have any concerns, kindly send them to us on text or via WhatsApp on 055 968 0066 055 968 0066. So we are going to go for our first break. When we come back, we'll go right into the conversation about prostate gland. Stay with us.
Cocoa dairy-free coconut milk. Cocoa dairy-free coconut milk is a fully plant-based milk, non-curdling in tea or coffee, and it's a lovely treat with any breakfast beverage or meal. It contains calcium and vitamin D2 for strong teeth and bones, and vitamin B12 to help boost your blood for vitality. Cocoa is 100% vegetarian and is approved by the Vegetarian Society of UK. It's also lactose and dairy-free, which is good even for people with lactose intolerance. Cocoa, get one today. Cocoa dairy-free coconut milk. Nature's health at your doorstep. For bulk purchases, contact 027-444-0180. This advertisement has been vetted and approved by the FDA. Cocoa dairy-free coconut milk.
Yes, so I echo and until was South Central Ghana Conference. 2nd July, Kita on Sunday there to Sumieno as he was say, or then Kuya did not ma abwa amanya mijuma akoso ewo asem park
odumadi mu tu yensa fani ntene kudan bebrebe bi ne honorable Simon Osemensa so odumadi chine Pastor Dr. Samuel Entwi so for Joseph say chuma amianchia ebra abono mo twapa ho sima aduasa 2nd July 2020
I experienced a new phase of healthcare with the aim of making this world happier.
Well-equipped wards and emergency center, advanced laboratories, high-tech theaters and dialysis center, plus a motivated staff with the latest facilities. You can be sure that your healthcare is important to them.
Let me introduce you to New Leaf Hospital on the Bamiri Road, opposite VRA office, Techiman, where quality healthcare meets. I experienced a new phase of healthcare with the aim of making this world happier.
Well-equipped wards and emergency center, advanced laboratories, high-tech theaters and dialysis center, plus a motivated staff with the latest facilities. You can be sure that your healthcare is important to them.
Let me introduce you to New Leaf Hospital on the Bamiri Road, opposite VRA office, Techiman,
where quality healthcare meets affordability.
COVID-19 bay. Ne ho nsɛm ayɛ pii. Na sese mo chendo kra nye vaccine asɛm aba. Obi arebisa de. Susampa de utwa de ye wo bi ana. COVID-19 vaccine. Onye vaccine 6 killer disease vaccine ye wo ye ma. Bra ya wo hon no wori yin. Nsusuru bia yim. Se yanwo dem mofraba droba na. Yebenya manzi osande dodo na benya polio, tuberculosis na nankeka ho. Inti obia de America kowo. Dem sasonso na otwa de. Yenyina yebo yenyimbiru. Na COVID-19 vaccine aba. Yesu ye wo bi. Dementi mama obi na ada ode. Ewo COVID-19 vaccine na enya mark of the beast. Anke ye mofra ba ya wo hon ofimre to bri nyina ya wo won dem drobe. Enche mark of the beast anke wonyan. Onye onu bia mark of the beast na onye droba, onye vaccine. Omye nsuane enta sede. Oya pomode hihye. Na ne mrimu no ewurade be yinima if you are how now which you be. Obiara ntwa na mona oboboa ni nyamso it's more Christ Jesus.
This message is brought to you by Adventist Development and Relief Agency Ghana in partnership with Hope Channel.
My dear friends, you've been listening to me for some time. Hope Channel created for me to talk about my life, my marriage, my ministry, my parenting, and many call skills that I should put it in a book for. This is the book. It talks about my childhood, my secondary education, my education in general. It talks about my marriage, how I became a Seventh-day Adventist, how God called me into the ministry, what the Lord has used me to do in 42 years, how many campaigns I conducted, my parenting, and what my children are today. And I'm appealing to you to have a piece 20 CDs. And it is going to help you a lot. So try to get a copy. And get a copy for a brother, a son, or a friend. For students, for pastors, for parents, for church members. I wish you well. You will enjoy reading it. God bless you.
Hallelujah.
Hi, you're welcome back to the consulting room. Today we are talking about the prostate gland. I have with me on Zoom, joining us very shortly on Zoom, is Dr. Entry. He's having some technical difficulties, but he'll be with us shortly. But I want us to share one or two things I know. Since the specialist is here, I'll just give you the general knowledge I have about the prostate gland. And when the specialist comes, he give us specialist knowledge, so that by the end of the conversation, we'll all improve our knowledge base. So the prostate gland is not prostrate. Those who have been saying prostrate, no, it's not called the prostate gland, sorry. It is prostate. There's no, prostrate means to lie on the floor or to lie down, yes. But then the gland in the human male is the prostate gland. There are three main diseases affect the prostate gland. We have an basically inflammation of the gland. We have the cancer of the gland, and we have when the gland gets big, but then it is not because of a cancer. So today we are going to have a conversation about the gland getting big, or when there's hyperplasia of the gland and it's not a cancer, because a lot of the cases that involve the prostate is with the BPH, or the benign prostatic hyperplasia. So the prostate gland, it's a gland in the male, as we all know, and it's a very small gland. Actually, it weighs just about 15 to 20-30 grams. That's a very small weight. If you don't use those very good scales, you cannot even weigh 15 grams or 30 grams. And it's just underneath the bladder. So the part of the prostate gland is it's attached to the bladder. It's also a part of the urethra. That is the part through where the urine passes from the bladder. It passes through the prostate gland. I want us to take note of this, because most of the signs and the symptoms that we would see when somebody has an issue with the prostate gland would affect the person's ability to urinate and urinate well. It's because the urethra passes through a portion of the prostate gland, and the incidence. So typically at age 40 and above, the prostate gland starts getting enlarged. And the fact that it is enlarged doesn't mean that there's anything wrong with it. There's only something wrong with it when you start having symptoms that shows that it is enlarged. We'll talk about the symptoms as we go on, but then the prostate gland gets bigger, or it increases in size when you hit 40 and above. I don't know if that is part of the reasons why they said life begins at 40, but well, you never know. And only about 1 in 10 males after 50 years experience the symptoms of the enlargement or the increase in size of the prostate gland. Yes, 1 in 10, you might think it's not a big number, but then for the medical field, 1 in 10 is quite a lot, because if you take 100 people, you're having 10 people. If you take 1,000 people, you're having 100 people having their prostates getting enlarged. So that is quite of a problem. Unfortunately for us in Africa, we are the ones that easily get our prostates getting enlarged. When I say we, I mean the men. I definitely cannot have prostate enlargement because I'm female. Yes. And our side Africans, we have some Caucasians, the white, and those who are of the Asian origin, they have the lowest incidence, meaning they don't really have people getting their prostates getting enlarged in Asia. But then if you are African or of the African origin, the incidence is quite high. So I've spoken about age being a factor, and also if you have a functioning testis, that is, if when you check your scrotum or when you touch your balls, you feel the two in it, and those two balls are secreting the hormones and the chemicals they are supposed to secrete. Once you have that, you are at risk of getting prostate hyperplasia or your prostate getting big. Also, for this fact that I just mentioned, if you were, say, castrated, whether medically, physically, manually, whatever way, or your testis, the two balls were removed before you reach puberty, the end of puberty, then you wouldn't have prostate. You wouldn't have to worry about your prostate getting enlarged. Also, you are at risk of getting prostate enlargement if you have anybody in your family that has had their prostate, they've been diagnosed with prostate enlargement, or you have a woman in your family, either a woman or a man, who has been diagnosed with breast cancer. So there's the genetic part, but then there's also some lifestyle and environmental factors that contribute to the prostate enlargement. We'll be having Dr. Entry joining us very soon. Don't worry, I'm just holding the fort as he tries to overcome the technical challenge and gives us the expert knowledge on that. So people think once your prostate has enlarged, then it means that you're going to have issues with your urinating or voiding. Yes, that's urinating. No. The size of the prostate does not correlate to the symptoms, even though it can affect the symptoms, but then it is not necessarily the case. So, what are some of the effects of, or the signs that you see when you have your prostate getting enlarged? One, there's straining. So when you go to the loo or the washroom to go and urinate or pee, you have to push. You know, when you go to the washroom to urinate, you don't necessarily have to consciously push the urine out. But then when there's prostatic enlargement, or if there's prostatic enlargement, you start getting the straining. That is a sign. Also, for some people, for this example, let me use babies. When newborn babies are the male, they are born, you see that they can urinate very far. Maybe when you are changing their diaper and you are not even careful, they can even urinate into your face. So that stream of urine is a very good stream. That is why we tell you that when you see a baby who urinates right onto themselves, when you place them on their back or when you have them naked, it's not a good sign. But then for the good sign, the baby's urine will go far. And even you see some of these young boys using that, they play with that. Oh, my urine gets farther than yours. It's a sign, it's a good sign. But then when you start getting prostatic or the prostate starts getting enlarged, your urine stream reduces. It becomes weak, so it doesn't go far. You can even just urinate on yourself through no fault of yours. Also, when you have issues with your prostate gland, when you go and void or you go and urinate, you might feel that there's some of the urine left behind. You have that very uncomfortable sensation. So because of that, you might have to go to the washroom several times, because when the urge is there to urinate, sometimes if you don't go, you will urinate on yourself. That is called urgency. And sometimes too, even when you have that urgency, you can have hesitancy. So you get there, you are pushing to urinate, but then the urine is taking its time to come. And as it's taking its time to come out, it is not going far. It is probably just pouring on your feet or something like that. So if you're a man and you've started, especially you are African, you are of the African race, Black American, Black, anything, if you have any black genes in you and you are over 40 and you start seeing these symptoms, you start seeing these things in the way you urinate, you should start asking your doctor or your healthcare provider to help you check if your prostate is okay. Also, some other signs that, okay, so I think we have Dr. Enchi here. I don't know if you can hear us, Dr. Enchi.
Yes, I can hear you, please.
Oh, okay, thank you. Thank you very much for joining us. So I was trying to tell them just a bit about the prostate that I know. I've just told them about some small anatomy and some small etiology, but then I know that you just go over it and give us the conch sauce. So you are welcome to the consulting room once again.
Thank you, madam.
Okay, so we'll just go right into the conversation. Why is there so much news and so much worry about prostate in men so much nowadays? Is there a reason to that?
Yes, I'll say yes, because these days people are becoming increasingly aware of their, and so the slightest thing, everybody wants to know something. But you just asked me a question to ambush me, so you did not give me the opportunity to say good evening to you.
Oh, I'm sorry. Kindly greet us.
It's a privilege to have an interaction with your viewers and then also to share some medical knowledge.
Yes.
Prostate disease has been with human beings from the time of Adam. Let me be like that. Because if you go to the Egyptian pyramid, where they carry their great men, and you want to have around, you realize that some of their great kings that were buried about thousands and thousands of years back, some of them would have wooden catheters in their caskets or coffin.
Oh, interesting. So
you ask the tour guide, why did you put these wooden straw? They will tell you, well, as a man, we know one day he could get to urinary retention as he's going to the underworld. And if that should happen, then he can use it to relieve himself. So this tells us that prostate diseases, urine retention, BPH, and all that kind of things has been with human beings from time immemorial.
Okay.
But these days, we are making more noise because we have the medium to communicate with people.
Okay.
I'm sure that is why we have all these things.
Okay. All right. That's very good to know. So, which people necessarily are predisposed to getting prostate issues? Because I suppose it's not everybody that is at risk of getting, it's not everybody that is at a high risk of getting prostate issues. Do you hear us, Miss? Okay, so he will join us. Dr. Enchi will join us very soon again. As I mentioned, he's a urologist at Conversational Teaching Hospital and Tafo Government Hospital, all in Kumasi. So those of you in Kumasi, you can go and see him personally, and he would help you with all your prostate issues. So we were talking about some of the signs. Before he came, Doc brought I told you, specialist information is always conk. You see where he started from. He sent us to the pyramids, and he's told us that it's not a disease of nowadays. It's a disease from the time of Adam. Well, Adam was a man. He had a prostate. So, yeah, it's a disease from those times. So we've gotten a little background on the prostate enlargement. We got to the part where we were talking about some of the signs and the symptoms that... Okay, you're welcome back, Dr. Enchi. Could you kindly unmute yourself?
Yes, I was making a point that the old Egyptian literature also talks about it. And so it is not a current disease.
Yeah.
But human being as we are, as we age, like you rightly said, our prostate increasing in size. By virtue of the fact that you are a man, you have your testes, which keeps on producing the androgens. When I say androgen, these are the hormones that makes men behave differently from women.
Okay.
Once your production side still being active and you are aging, then your prostate can also increase in size.
Okay.
By 4 years, all of us will start having increase in size of prostate.
Yeah.
But what you said is true. It's very few of us who will present with the lower urinary tract symptoms. If you open up the bladder and then you really examine the prostate, you can see that there are some people whose prostate are enlarging, but they are not enlarging, coming close or encroaching on the bladder neck. These people, they would be able to urinate, although the prostate is enlarged.
Okay.
Your will be so huge, but by virtue of the fact that it's enlarging medially into the bladder neck, you would get lower urinary tract symptoms.
Okay.
Or tension. But having said this, let me also quickly take your viewers back a little bit.
Okay.
You know, prostate has a very big role to play. And I'm not surprised that is why you want to link up the prostate discussion to the Father's Day.
Yes. Yesterday will be in Father's Day.
In fact, without the prostate, you can't be a father.
Okay.
It has a vital role. I always tell my patients that the journey for the spermatozoa from the loins of the man to the loins of a woman to cause pregnancy is very, very long and tortuous.
Okay.
We need amount of energy to vitalize these spermatozoa to be able to travel this distance. And it's the secretions of this organ, that is the prostate, that help to energize these spermatozoa.
Okay.
And so without, you will not be able to fertilize a woman. You really need to be a father.
Yeah.
And so that I want us to establish as we move on.
Okay. Okay. All right. Thank you very much for making us see the use and the need of the prostate gland in the human formation, in human population too. So I was, before we went off, I asked about some people being predisposed to getting the prostate enlargement, and you were talking about having the testes, and once it is secreting androgens, which you explained as the hormones. Are there any other factors that predisposes somebody to having prostate issues than the other?
Yes, when you say prostate tissue, let me be very clear. We are talking about benign enlargement.
Yes, the enlargement.
Yes, it can be prostate cancer, it can be prostatitis.
Yeah.
There are an interplay of factors that will make experience the growth of the prostate. The androgen is one of them as you age. There are lots of growth hormone, growth factors.
Okay.
And then the balance between estrogen and your androgens, all these things come into being.
Okay.
And it's like almost every man goes through these things, almost.
Okay.
But then, let's say 1 out of 10 will really present with a clinical situation.
Okay. Okay. So thank you very much for that one too. So you mentioned in the beginning that the ancient Egyptians used to put some wooden straws as a form of catheter in their coffins or with the mummies, how they preserve them. Is just the issue with prostate enlargement? Is it just, do you see the symptoms with just how someone urinates, or there are other things that happen when someone has that problem? Yeah, please, did you hear my question? Dr. Enchi? Dr. Enchi? Okay. So as we wait for Dr. Enchi to join us, we'll continue our discussion as we were having it. So, okay, Dr. Enchi, if you hear me, we are listening to you. Kindly unmute yourself again for us. Okay, Dr. Enchi.
Yes, madam.
Yes, so I was asking about some of the signs and the symptoms that one might experience when they might be having their prostate getting enlarged.
Yes, I'm sure probably you might have talked about some of them.
Yes, I did.
Yes, by virtue of the fact that your prostate is enlarged, and per its anatomical position, you know, it is just right under the urinary bladder.
Yes.
We'll say the prostatic urethra, that part of the urethra that passes through the prostate, can be sort of constricted by the prostate. As the in the prostate increases, it can increase resistance in the urethra.
Okay.
And for that matter, flow of urine can be impeded. And so these people, sometimes they would have to strain before the urine comes. That is one important thing we have to consider, straining at maturation. Then the other thing too is, you know, when we are young boys, we and then sometimes it can even form a very nice arc.
Yes, yes. Some people do competition with that.
Yes, sometimes if you have some naughty boy, they can even wee and it will be touching the ceiling fan or behind the flow. But as we age and the prostate increases in size, it can impede the flow. And so you see a man, middle-aged man, 50-year-old plus, they wee and then it will be dropping on their shoes. It's because the stream is weak or very poor.
Okay.
Put this one aside. There are these people at night, they have to wake up several times to urinate, what we call nocturia.
Okay.
And so every man who was
okay, so Dr. Enchi. Okay, so Dr. Enchi was talking about nocturia. It's just basically waking up at night to urinate. In every normal human being, you're supposed to wake up at most once or twice during the night to urinate. But then if you're waking up about 4 or 5 times, 3, 4, 5 times at night, and it's outside, it's disrupting your sleep, it could be a sign of your prostate being enlarged in a man, or some other diseases too. So Dr. Enchi was talking about nocturia. And also there's also frequency. So there are some people that they have to go to the washroom sometimes every 30-40 minutes, every hour. They have to get up, and if you are working with them, or if you are at a conference with them, those people can disrupt work, and they can disrupt a lot of stuff, the activities going on around them, because they always have to excuse themselves to go and urinate. So if you're a man above 40, 50 plus, you are black, you probably have had somebody that has had breast cancer or prostate enlargement or prostate cancer in your family. You should be on the lookout for that. Aside that too, we have urgency. So I think I mentioned that already. Some people have, if they don't go and urinate, they'll just sell themselves. If they don't quickly rush to the urinal, or they don't find some corner somewhere, which is a very bad habit, I think we should advise our men to stop, because it's not nice. If they don't quickly go and urinate, they would urinate on themselves. Also, some other signs too could be having blood in your urine. It's not normal to have blood in urine. Urine is supposed to be either clear or we call it amber, or slightly yellow. Yeah, that kind of color. Urine is not supposed to be dark. Your urine is not supposed to be the color of my shirt. Your urine is supposed to be clear, or it's supposed to be amber, slightly yellow. So if you have your urine being dark, being red, you can actually see blood or some blood clots in your urine. There's an issue that you need to have it checked out. If you have recurrent urine tract infections, so you are always having issues with how you urinate, you are having infection, and you are always treating for urinary tract infection, you have to get it checked out. The prostate enlargement could lead to you having kidney problems. It could be acute, it could be all of a sudden, that's acute, or it could be chronic. It could be with you for a long period and it shows up suddenly. So if you have any of these things we've spoken about, intermittency, urgency, straining, poor stream or weak stream, hematuria or blood in your urine, or discolored urine, or you have intermittency, as I've already mentioned, you should go see your doctor to see if he can discuss you being at risk of prostate enlargement. So you're welcome back, Dr. Enchi.
Yes, madam.
Technology is a good thing, but we always have issues with it sometimes, especially in this part of our world. Okay, so you were talking about nocturia before we got interrupted.
Yes, I did mention nocturia. I did mention poor stream.
Yes.
You could also feeling of incomplete bladder emptying. And then you could also have sometimes you could even get bleeding BPH, where your prostate is enlarged, and because of that you could also even have blood in your urine. Yes, there are some people, they could also present with some complications, but before I come with the complications, there are instances you also have hesitancy. You enter the washroom, you want to wee, but it takes you some time before you start giving out the urine.
Yeah.
So you even have to break in between, what we call intermittency. win and then you stop, you gather some momentum and then you restart. All these should help you to realize that there is some form of impedance to the flow of the urine. These are basically the presentation, but some people would also present with the complication of the disease. In our part of the, we don't do regular medical screening. We only would have to wait until we develop the complications before we come, which is not good enough. If an adult presents to you with, let's say, a groin hernia, sometimes it could just be as a result of the prostate. By virtue that your prostate is enlarged and it is causing you to strain, you could develop yes. And in such case, what we advise, what we teach, is that you don't jump on the hernia and manage the hernia.
Yeah, if you don't work on the source.
That's it. Yeah. That's it. Very, very important. Some men would even present with hemorrhoids. What people by investigating the hemorrhoids, you come to realize that, oh, if I don't deal with the prostate, I cannot manage the bowels.
Yeah.
Are very, very important things. So these are the complications. Some even would even present with renal failure. You know, I'm jumping because I don't know what the internet will do next. So I'm just trying to lump up.
I think I'll just leave you to talk about it.
Yes, some people would also just present with renal impairments. Their kidneys, that is why they think they have to come to the hospital. But in actual, it can be as a result of the enlarged prostate. And in fact, most people we see at this stage, we sometimes have to weep for them. Because prostate enlargement is a very simple thing that can be managed. But if you should sit down, wait until you develop renal impairment, then you are really harm to yourself.
That's kidney issues, kidney problems.
Kidney problems.
Yeah.
So, you know, when you urinate and then you are not able to empty your bladder fully, okay, you have what we call residual urine. And when residual urine in the bladder is significant, then what it means is you are going to get a backflow of this urine, or let's say there will be a pressure on the kidneys. And then you're going to develop what we call hydronephrosis. And if you develop the hydronephrosis, then it means probably the prostate is blocking the flow. And so the little you
Okay, so as we wait for the network to get stable again, we have a message from, we have some questions from Dan in Kumasi. He says, is there any relationship between BPH and the frequency of ejaculation? I'm just hoping doctor comes back to come and answer that one expertly for you. And also, there's a question on, can you explain why men above 40 should reduce the consumption of red meat for good prostate health? So I think it's not just men above 40. We preach moderacy in everything. So if you are consuming lots of alcohol, you are not eating healthy, you're not exercising adequately, you are just putting your general well-being in jeopardy. So the question about the frequency of sex, I also want to know. So let's just wait for doctor and he'll come and answer that for us, hopefully. Gabriel says, good evening, Dr. Kosa. My name is Gabriel. We are grateful for the education. I would like Dr. Enchi to touch on how prostate enlargement contributes to erectile dysfunction, premature ejaculation, and semen mobility or motility. Again, what is the clinical significance of pressure of the prostate gland? So I will tackle this clinical significance. Just as Dr. Enchi was saying, the prostate enlargement doesn't necessarily mean that there would be pressure on your urethra or where the urine passes. But then if it's enlarging into it medially, it's enlarging into itself, you could have pressure on the urethra. So we've already spoken about some of the pressure symptoms. You are going to strain when you are urinating. There can be frequency, there can be nocturia, that's getting up at night several times to urinate. It could also even cause some bleeding, the bleeding BPH that he mentioned. So that's the significance of it. What are some of the things we do when somebody comes? So for somebody that comes to the hospital, you have a general examination. The doctor will ask you a whole lot of questions. Don't get bothered when doctors ask you a lot of questions, or when your healthcare provider is asking too many questions. It's just to make sure that he or she is getting the most accurate thing that is happening to you, because there are lots and lots of diseases and conditions around, and a lot of them are similar. So if the doctor is asking about how many times you urinate at night and you think it's bothering you, is the pain in your abdomen that you brought, the doctor knows why, the doctor or the nurse or the health provider knows why they are asking about that. Also, aside the asking of questions or taking a history, the health practitioner would also do some examinations. So they touch you. They will touch you, touch your abdomen, check your heart, check your lungs, basically do a general examination on you to make sure that, okay, so you're welcome back, Dr. Enchi. I was trying to hold the fort for you, but we have two very interesting questions here, and I would want us to tackle that before we move on. Please, do you hear me?
I can hear you.
Okay, so Dan from Kumasi is asking if there's any relationship between BPH and the frequency of ejaculation or sex. And there's a similar question from Gabriel. He is also asking how prostate enlargement contributes to erectile dysfunction, premature ejaculation, and semen mobility and motility.
Good. There's been a lot of speculations about the number of times we ejaculate and prostate health.
Yes.
Especially when we talk about prostate cancers, people would always want to link it up with the number of ejaculation. Mm-hmm. Some say 21 times in a month is ideal. Some say 30 times is the ideal. So there are several relations. Now, what I know is regular adequate sex is good for the prostate. Yes. You know, the prostate has a lot of ducts that runs through the prostate. And these, anytime ejaculations, you flushes through these ducts.
Yeah.
So you keep the prostate healthy.
Okay.
People believe that if you ejaculate more, you have some protection against prostate cancer. Let me say, to some extent, all these things are at speculative stages.
Okay.
Now, danger here is, yes, if it is a regular partner, having any problem. But if you live by that assumption and you keep on moving from bed to bed, then there is a tendency that you pick one of these STIs.
Yes.
And you come with prostatitis, which is all a condition that affects the prostate.
So in your bid to prevent one prostate issue, you've gotten another one.
But in general, it is known that regular adequate sex is good for the prostate.
Okay.
In general.
And there was also the question about erectile dysfunction. If prostate enlargement affects that, erectile dysfunction, premature ejaculation.
For premature ejaculation, there isn't much of a link, but rather with prostatitis could also have premature ejaculation to some extent.
Okay.
Now, some literatures have supported the fact that prostate enlargement could affect one's erection.
Okay.
Personally, I attest to the fact that there are some people after simple prostatectomy where I do surgery to remove the part of the prostate that is encroaching on the urethra.
Mm-hmm.
And they come back to me, they are happy, and then they say their sex life has improved. It's quite difficult to explain, but it is well documented that most people, after prostate management, they get good erection.
Oh, okay, that's good to know. Well, so Gabriel and Dan, I think your questions have been answered. So you were talking about treatment. So if you can give us a brief, something brief about what you do when somebody. Hello, Dr. Enchi. Dr. Enchi. Okay. So we've had him mention the sexual frequency and its relation to prostate enlargement. So don't go and sit anywhere and say that consulting room, we said that you can go and ejaculate 21 times in a month, so you'll be hopping from one bed to another. No, you have to protect yourself. If it's with your partner, as Dr. Enchi mentioned, yes, you can do that. Well, it helps with bonding, sex. Okay, so we've had some conversation about prostate health. I hope we will do this again so that we'll be able to get better understanding about the prostate and all that there is about the prostate. And as usual, join us next week at 8 p.m. and next week Monday at 8 p.m. Also, the show is repeated on Saturdays in the afternoon, and do well to rewatch it so that you can consolidate all the information that you've heard today. I'll be glad to have you here in the studio next week Monday. Have a good evening.